Hi, are you ready to learn about the CPT changes of 2023? This is the highest request of this month, I believe. So, in today's video, we're going to see about CPT changes 2023 in general. This is Surya Johnson, your medical coding guide. Hi, in today's video we'll see about the CPT changes of 2023. So in this video we'll be seeing the general CPT changes, what has happened in 2023, and in my next video I'll be explaining in detail about the evaluation and management, that is the E&M section CPT changes and also E&M guidelines in my next video. So if you don't want to miss it, please subscribe. If you have not subscribed yet, hit the notification bell icon. So let's dive in. So, we will see the summary of how many number of CPT codes have been changed in 2023. So, totally 225 new codes have been added and there are a total of 75 deletions and there is around 93 revisions. 93 revisions in the sense there is a CPT code, it remains the same, only the description or some addition in the description, the CPT will be revised, these 93. So, total number of 393 codes have changes in this 2023 year. We will see an overview in the CPT changes. So, there are coding and guideline changes in almost every section of the CPT 2023 code set except anesthesia. So, the only chapter that has no change in 2023 is the anesthesia chapter, and obviously it is a very small chapter, so that will not affect much, and that is not a much significant difference, I think, here. So, the next point, the most significant changes are to the E&M section, evaluation management section, percutaneous pulmonary artery revascularization, hernia repairs, lab and pathology, and also they have introduced COVID-19 vaccination codes. So, these have significant changes and the other chapters have minor changes only. There are two new appendices added in this year, Appendix S and Appendix T. So, Appendix S is all about the artificial intelligence that are used in the medical field. There are so many artificial intelligence, right? There are so many robotics involved in diagnosis and also for surgery purposes. So, these codes are in the Appendix S, and in Appendix T we have the synchronous real-time interactive audio only telemedicine services. So, these telemedicine services which is audio only, that is only the voice, the phone calls like that, these services have been segregated into the Appendix T. So, people who are going for 2023 exam but who have been trained in 2022 pattern books and everything, make sure to take notes of all these changes so you do not get confused, because obviously you will all be having a 2022 code book only, either an original copy or a photocopy, and you have been trained with those codes only. So, it is not a huge change, but it is good if you can take notes and if you can know what are the changes, because there might be questions with these different change codes. So, if you have an idea, if you can go through the guidelines again for these changes alone, it will be of much use for you during the examination. So, we will start with the evaluation and management section. For 2023, there is only one addition for this, and then there are 26 deletion and there is around 50 revisions has been made in this. What is that one addition? It is in the prolonged inpatient or observation evaluation management service. They have added 99418 for this new code, for this prolonged inpatient or observation E&M service. So, this time code each 15 minutes of total time, list separately in addition to the code of inpatient and observation E&M service. So, this is an add-on code. So, this add-on code 99418 can be used for use only after the highest level of E&M is reached based on the total time in the inpatient and observation care or nursing facility. So, this add-on code is reported in 15-minute increments because the description says so. So, we will be coding this in 15 minutes increment, and code 99417 is revised, which is the previous code for this code. So, this is a new prolonged code they have introduced, 99418. So, the billing guidelines for 99418 is you bill the CPT only for the time that is 15 minutes beyond the time required to report the highest level of primary service. And also you can bill only when the primary service has been selected using time alone as the leveling factor. So, any E&M service which has been selected using the time criteria, those codes alone are eligible for this add-on code. So, for example, if you have chosen any other E&M services that are not time based, that are like MDM based, in this scenario you should not add this 99418. So do not bill 99418 for prolonged service of less than 15 minutes. So if it's the total minutes is less than 15 minutes, this code is not eligible to be billed. You got the point in 99418. Next, under the E&M section, we will see about the deleted codes and alternate reporting codes. So there are codes some deleted, right? The major deletion is in the observation section, the observation care, discharge day management, and initial observation care, subsequent observation care. As you can see, some codes like as you can see in the tabular list, 99217 under the observation care, discharge day management has been deleted, and in that place you can use either 99238 or 99239. Likewise, for the initial observation care, 99218 to 99220, that is the entire observation care of the initial and subsequent section has been totally removed. Instead, they have replaced them with the 99221 to 99223 section, 99221 to 99223 for the initial observation care, and 99231 to 99233 for the subsequent observation care. So under the office consultation, the level 1 codes were deleted. 99241 and 99251 were deleted and were replaced by 99242 and 99252 respectively. So next deleted codes are under the E&M category, annual nursing facility assessment. So they deleted 99318. Instead, they gave a set of codes 99307 to 99310 to be chosen from. The next E&M category is the domiciliary or rest home visit for the E&M of a new patient, an established patient, and also a home care plan oversight services. Some codes have been deleted from these sections and they have been replaced with 44 codes to be reported. So there is also a change in the home or residence services. So 99343 was deleted. Instead, they have replaced codes 99341, 42, 44 and 45. So the next one is the changes in the prolonged services. 99354 to 99355 has been replaced with 99417, and 99356 to 99357 has been replaced with the 99418, which is the new code that we discussed in the beginning for the prolonged service, right? So this codes has been so these are the codes that has been deleted, and there is also alternate reporting codes. So if you can take notes, you can if you're using 2022 CPT code books, you can go to that code system and next to that you write down the replacement codes. So it will be easy for you in your preparation with the 2022 code books. So there are some new E&M guidelines that have been changed. So we will look into that, and based on those guidelines, some codes definitions, that is the codes descriptions and the guidelines have been revised. So what are the new guidelines? Just we will see what are the new guidelines for this, and then we will see about the revised codes based on these guidelines. So here for the new E&M guidelines, history and physical examinations. The first one, E&M codes that have various levels of services include a medically appropriate history and or physical examination when performed. So when there are levels of services for E&M codes, in that case when there is history and physical examination performed, these services they can be calculated. So the next one, the nature and extent of the history and or physical examination are determined by the treating physician or any other qualified healthcare professional reporting the service. The extent of history and physical examination is not an element in the selection of the level of these E&M service codes. So the codes that have been revised, the extent of the history and the physical examination is not an element moving forward in the selection of the level of the E&M service codes. The next one, the time based codes. So when time is used as a factor for reporting E&M service codes, the time defined in the service descriptors is used for selecting the appropriate level of services. So each E&M codes that are time factored codes has some time descriptors. You should look into those descriptors while selecting the appropriate level of services. Also, the E&M services for which these guidelines apply require a face-to-face encounter with physician or any other qualified HCP, healthcare professionals, and the patient and or the family or caregiver. So these services that has been revised, they should have the face-to-face encounter. And lastly, time is not a descriptive component for the emergency department levels for E&M services. So based on these guidelines, these new guidelines for the history and physical examination and the guideline for the time based codes, the below codes have guidelines and the descriptions revised based on these guidelines. Like we have the already existing hospital inpatient and observation care services, they have been clubbed together from this year. So these 99221 to 99223 and 99231 to 99239 series have revised guideline and revised descriptions. Likewise for the consultations, that is 99242 to 99245 and also 99252 to 99255. Likewise in the emergency department services, nursing facility services, home or residence services, prolonged services, an interprofessional telephone or internet or electronic health record assessment and management service, assessment of and care planning for patient with cognitive impairment, and transitional care management services all have revised description and guidelines based on the new guideline for the history and physical examination and time guideline. I know you are all confused what I am talking about, right? Don't worry, this is just an overview of the 2023 CPT changes in general. It will be covering from E&M to all the surgery, radiology, medicine part till medicine part. So in my next video, I will be starting with the E&M 2023 coding guidelines, where you will be seeing each E&M sections with the guidelines, with the code, with the descriptions in detail. So don't worry. So the next change for the 2023 is under the surgery section. So first we will see about the integumentary. So in the integumentary, that 15850 code has been deleted. So 1585 is for, if you remember, it's a removal of sutures under anesthesia. This code has been deleted. Instead 15851, which is already there, has been revised, where they removed the other surgeon word from the code descriptor. And also there are two new add-on codes, which is 15853, 15854. What are these? 15853 is for removal of sutures or staples not requiring anesthesia, and 15854 for the removal of sutures and staples. So the difference is that is either sutures or staple. The 15854 is for removal of sutures and staples both, not requiring anesthesia. I believe this is a game changer because there are so many patients who come to the outpatient facility, specifically for the outpatient setup, where they come for the removal of suture alone. You know, we are not able to code a separate code because it is not removed under anesthesia. So we are not able to, we are not eligible to be coded with 15850. Why? Because it is performed under anesthesia. So usually it has been built with the E&M level only. But now this will change for so many facilities out there. So code we have two codes, 15853 and 15854 for removal of sutures and or staples that do not require anesthesia. The next under surgery section is the musculoskeletal system. So for the total disc arthroplasty, 22857 has been revised to make it as single interspace lumbar. So this has been revised. So there is another word, single interspace lumbar, a suffix has been added to the description. There is also a new add-on code, which is 22860 when total disc arthroplasty is performed on the second interspace of the lumbar spine, because they have introduced the word single interspace lumbar. So to fill the gap for the second interspace, subsequent interspaces, they have added this code 22860. Next we have the respiratory system surgery. There are no deletion or there are no revision in this respiratory system. There is only one addition in this respiratory system. So there has been a new code added for the repair of the nasal valve collapse. 30469 is added to report the use of low energy temperature controlled subcutaneous or submucosal remodeling. So this code has been added for the nasal valve collapse repair. So the next under the surgery is cardiovascular system. CPT 2023 includes 5 new codes for percutaneous pulmonary artery revascularization by stent placement. So they have introduced guidelines and parentheses for this section because they have introduced 5 new codes. They have also introduced guidelines and parentheticals to be used for this 5 new codes. So code 33900 is for an initial procedure performed unilaterally in normal native connections. Likewise 33901 for the initial procedure performed bilaterally. 33902 is for the initial procedure performed unilaterally in abnormal connections, and we have bilateral for abnormal connections as 33903. There is an add-on code 33904 for each additional vessel or separate lesion in normal or abnormal connections. So these add-on code can be used for all the above 4 new CPT codes. There is also 2 new codes that have been added for percutaneous arteriovenous fistula creation. So there are 2 codes for arteriovenous fistula creation. We saw 5 codes for percutaneous pulmonary artery revascularization by stent placement, 2 codes for percutaneous arteriovenous fistula creations, that is 36836 and then 36837. So these 2 codes have been added. So under the digestive system, there is a huge extensive change under the hernia repair codes. So before that, there is a new code introduced for the EGD, that is esophagogastroduodenoscopy. They have introduced 43290 for the EGD with the deployment of an intragastric bariatric balloon. So for the removal of the intragastric bariatric balloon by EGD, you can use code 43291. So these 2 codes are there. So there is an extensive change in the hernia repair codes for abdominal hernias, which include epigastric, incisional, ventral, umbilical and Spigelian hernias. So there are 18 codes that has been deleted and they were replaced with 15 new codes. I am not going to give the code details, I will just give the code range only. So the introductory guidelines and parentheticals are also added. So there are some guidelines for this specific 15 new codes that have been given. So the new code family includes any approach, because these procedures can be performed using a combination of approaches in a hybrid model. So select these codes based on whether the procedure is initial or recurrent, reducible, incarcerated or strangulated, and the total defect size. So based on that, you will be selecting this code. So code ranges are, for the initial procedure it is 49591 to 49596, and for recurrent abdominal hernia repairs it is 49614 to 49618. For the repair of parastomal hernia we have 49621 and 49622. So all the new procedures include mesh implantation also. So if during the procedure non-infected mesh is removed, you can add code 49623 in addition to the code of the hernia repair. So if there is a non-infected mesh that has been removed during the procedure, you will use this add-on code along with the hernia repair code. So this new add-on code can be only reported with the codes 49591 to 49622, the new 15 hernia codes. So if you are finding it difficult to understand, you can go back and repeat the video, and you can take notes in detail. If you have any doubts, you can put it in the comment section below as usual. I will be answering everything. Under surgery, urinary system, codes for percutaneous nephrolithotomy, or also called as pylolithotomy, that is 50080 and 50081, have been revised to clarify which services are included when performing the procedure, so they can be properly valued. So just to clarify the previous doubts we had, they have revised these 2 codes, and code 580 is reported for a simple procedure that involves stones up to 2 centimeter. So stones greater than 2 centimeter, branching stones, stones in multiple locations, ureter stones and anatomical complications are considered complex, and these are reported with 50081. So the next under surgery, male genital system, there is a new addition code. Laparoscopic simple subtotal prostatectomy has been added with a new code 55867. So this procedure includes robotic assistance when performed. The next one is the nervous system under surgery. So the codes in the nerve injection family 64415 to 64417 and also 64445 to 6448 are revised to include imaging guidance when performed. So there is a revision in the nervous system. Under the surgery, eye and ocular adnexa, codes 66174 and 66175 are revised to include the canaloplasty as an example. So under the auditory system, the osseointegrated implant procedure codes 69717, 719, 726 and 727 are revised, and 3 new codes have been added. So 69728 have been added, 69729 and 730 has been added. Under the radiology section, the descriptor for limited ultrasound code 76882, which is already there, has been revised to include focal evaluation of. This word has been added to that, and the descriptors for the tomographic SPECT codes 78803, 78830, 78831 and 32 are revised to include or acquisition word. So these are revisions, and there is one new code in this section, which is 76883, which is for the ultrasound of the nerve and accompanying structures throughout the entire anatomic course in one extremity. So for the nerve ultrasound, 76883 has been introduced. Then under the pathology and laboratory codes, we have a new code 81418 that describes the drug metabolism genomic sequence analysis panel. So inherited bone marrow failure syndrome testing is described with the new code 81441. They have introduced another new code for that inherited bone marrow failure syndrome testing. So codes 81445, 81450 and 81455 have been revised to specify that the procedure includes DNA analysis or combined DNA and RNA analysis. So when the targeted genomic sequence analysis panel for a solid organ neoplasm involves only RNA analysis, you can use 81449. And when the targeted genomic sequence analysis panel for hematolymphoid neoplasms or disorders includes only RNA analysis, you use the new code 81451. So under the medicine section, there are codes for COVID-19 vaccines which are released for early use based on the public health emergency. So the vaccine administration codes include the type of vaccine and the number of doses. So to properly report COVID-19 vaccine, there is an administration code and a supply code, and there is also appendix Q is added for coding clarification on the proper use of COVID-19 vaccine administration and supply codes. You can very well refer to the appendix Q for this clarifications. And there are 4 new codes that have been added to the cardiac catheterization subcategory for angiographic procedure: 93569, 93573, 93574 and 93575. So these codes have been added under the cardiac catheterization subcategory for angiographic procedures. So the last one is the category 3 code changes. So there are many new category 3 codes created for new and emerging technology, for the new latest technologies. For examples like for digital pathology, digitalization procedures, assistive algorithmic EKG risk based assessment, transcutaneous magnetic stimulation of nerves for chronic nerve pain, and also for virtual reality patient procedural dissociation. For these kind of new and emerging technology, they have added so many category 3 codes. If you want, you can refer to the category 3 codes in the CPT book, in the AMA CPT book. So if you have learned coding in 2022, if you want to go for 2023 exam, or if you are working for the 2023 year, it will always be good to go, because you cannot go and check the code book from first page to last page and read again, right? It's always better to find out what are the changes, go to that place, find that location and learn the new guidelines. So you'll have an idea. Take this as a guide. Hope this video was useful to you. If you found this video to be useful, please hit the like button. It will really mean a lot to me. And if you have any doubts, you can very well put it in the comment section below, and I'll try my level best to answer all these questions. And if you're new to this channel, I welcome you. Please subscribe and hit the notification icon so you'll not miss any of my future video. In my next video, we'll start with the E&M guidelines. Till then, happy coding. This is Surya Johnson, your medical coding guide.